Hi, and welcome to the MedTech Insider, where we give you an inside look into all things med device. My name is Parker Snedden. I will be your host for today, and I have a distinguished guest with us today, Dr. Chris Kim out of Charleston, West Virginia, pain management physician out there. Dr. Kim, it is wonderful to have you on today.
Thanks for having me.
Yeah, welcome to Kansas City.
Thank you.
And we were just talking, you've been here one other time.
Yeah, I was here about 2 years ago.
Yeah.
When you just had upstairs office.
Now we're downstairs.
Now you're downstairs.
I know. Just in a couple of years, we've expanded from the upstairs to the down. Maybe the middle floor is coming soon. I don't know, but we've got engineers and market access, and so I'm sure maybe things have changed a little bit in the last couple of years since you've been here.
Yes, definitely.
Yeah. Well, really looking forward to our conversation today. The first thing I want to talk to you about is you've been on like the forefront of innovation in this space, and you've been doing it for a while. So how long have you been in interventional pain, and what's your career looked like up till now?
I've been doing medical practice for about last 30 years, but especially mostly with minimally invasive spine procedures. So I call myself interventional pain docs now. Over the last 30 years, pain management has evolved quite a bit. So when I first started, there was nothing but what we call block shops, or people just show up and get some injections and get some pain medicine, and they try to manage their pain as much as possible. And over the last 15, 20 years, it has become a little more interventional, so to speak, because instead of just treating or managing pain, now we start treating the source of the problem. So we're actually doing things to make patients better for long term instead of just short term benefit.
Yeah, it's changed a lot since you've been in the pain space for 30 years, I'm sure. So you're on the forefront, as I mentioned, of all these new technologies coming out, whether it be Minuteman or Liberty. How do you process through whether you want to bring something into your practice or not?
Well, I'll definitely look at, obviously, patient safety comes first. And then next thing is the product or the new technology, is it treating what it claims to treat? Okay. So is the pathology meet the innovation or the technology? And is it for short-term treatment or is it for long-term treatment? What's the outcome? Okay. How much is the patient's getting better? Has there been enough studies, or has there been like trials? What's the outcome data? So, I need to look at all those things to make sure it's number one, it's safe for the patients. Number two, that's gonna be the procedure has to be reproducible with a reproducible outcome, with less complications or side effects. So even if it's a great procedure, if it's got major complication rates, then obviously it's not the right procedure for me. Okay? So I need to look for something that is safe for the patient with a good outcome, and yet it is repeatable.
Yeah. And I know you're helping patients with all kinds of different types of pain, but if you were to describe, like, what, in layman's terms, what is back pain?
That's a loaded question.
It is,
because,
isn't it?
because a lot of people think that back pain means there's something serious wrong with it. Okay, they think that, most people think that back pain comes from disc, and that's the first thing they talk about. I got bulging disc, or 5 bulging disc in my back. Somebody told me I have a really bad arthritis in their back. So I've been dealing with this for years. But back pain, for most part, could be just coming from just strain of the muscle, or a little irritation of the joints, or ligaments, or possibly compression of a nerve. So the back pain could be coming from many different things, but most people don't understand that part. So that's why when the patients come to see you or come to see me, I have to sit down and explain to them exactly where their back pain may be coming from and what could be done about it.
Yeah, we were even talking before the podcast in the room right next door. I love how you are an educator with your patients. You're not just telling them what to do, but explain that process for our audience.
Well, patient has to understand what the problem is, what's causing their back pain. Okay? So when patient comes to see me, I'll sit down and talk to them, and I ask them where the pain is coming from, how long they've had it, what makes it better, what makes it worse, and then we'll do the physical examination, and if there's MRIs and X-rays, I'll put it up on the screen, and we'll go over their pathology, okay? So when the patients understand what their problem is, they'll understand what needs to be done about it, and they are most likely to go with your recommendations. So, I think the patient needs to understand what the problem is and what could be done about it so that they become a part of the team. So when we decide to go and treat their problem, they'll actually be more than eager to participate in it.
Yeah, you're bringing them into that conversation and you're educating them on what's actually happening, showing them imaging. I love that because it shows just your care, that you're listening to your patients, and it's not just reading an image, right?
That's right, because, you could go ahead and treat the imaging, but often that's not where the problem is coming from. So you definitely have to combine everything together, especially you got to talk to the patient and listen to them and see what may be causing their problem rather than just treating the MRIs or X-ray findings.
Yeah. One question I asked you too, as we're preparing for this, is you obviously use Minuteman, and I was curious for you, how do you know if a patient could potentially be a Minuteman candidate? And you were talking about how they walk, and describe that for our listeners. I thought it was pretty interesting.
The first thing that I notice is the way they walk into the office. Okay, a lot of these patients are usually walking with a soup gait. Sometimes their gait is kind of shuffled. They almost walk like they have Parkinson's disease because they're afraid to take big steps because they are weak in their legs, they have poor balance, and they're afraid to fall. So first thing that I notice is the way they walk in. Okay. Second is you start talking to them and see what makes them better or worse, what position. A lot of these people will say, I could sit here all day and not have any back pain. But once I get up and walk 2 minutes, 3 minutes, I have to find a place to sit. Okay. When I go grocery shopping, especially female patients, they have to lean over the buggies, okay? Because that takes the pressure off their spine and allow them to be able to walk a little bit better and a little bit longer. Okay? So, and a lot of these patients have back pain, but they also have not so much pain in their legs, but they have weakness and numbness and balance issues. So, they are not very steady on their feet. And then you confirm everything with your X-rays and MRIs, and you talk to them about what options we have available to treat their condition.
Yeah, I've heard other physicians say, like, the patient's head's almost on a swivel, like looking for somewhere to go sit down.
Yeah,
because they can't stand or walk.
They're always like leaning against something, like walking with with the hands on the wall, or grabbing the furniture or something, so that because they're afraid to fall.
And there are so many therapies now, to your point at the beginning, with the space evolving over the last 30 years for sure, but even the last 10 years, that you could be choosing for these patients. And how do you decide, like, do I just master one of them? Do I, maybe one or two of them, three of them? Like, what's your thought process there?
Well, there are so many different products available nowadays. Every company is coming out with something similar or different, and they claim that their products are superior to another one. But obviously, you gotta look at the evidence. Okay? What's out there? What information is out there? We talked about, is there peer review? Is there, is there been studies done? Is there any outcome data available? What's the long-term outcome data? A lot of people will claim their product is superior to the others, and whatever the procedure they're offering will benefit the patients. But there's a lot of hype. Okay? I mean, so you got to pay attention to the evidence, and that's what the medicine is becoming, especially pain medicine, is becoming evidence-based practice, okay? Specialty. So, and you have to decide what product is the right for you. Obviously we talked about it. It's got to be safe. It's got to have the durability. It's got to have to last a long time and offer patients long-term relief rather than short-term relief. And it's got to have very low complication rate, and it's got to be repeatable, reproducible. Okay, so those are some of probably key things that I'm looking for when I'm like choosing one product over another.
Yeah,
so,
and you've even talked about like just moving from that mindset of managing the pain, palliative care, to maybe even fixing the problem. Talk about that, how your mindset has changed over the years.
Yeah, I think in old days, we were just managing it any way we could. We talked about opioid crisis that we had 20 years ago, 15, 20 years ago. And then everybody start moving away from drugs and pills because we know that all these things only mask the pain. You're not really doing anything for the problem. You're doing epidural injections and facet injections that may help, but they only last a few weeks or a few months at the best. So you're not really treating the source of the problem, but you're kind of managing it. And these people have to show up, come back to your clinic and get repeat injections and repeat blocks once every month or two to just make it more tolerable. Now, there are so many other things available. We call it minimally invasive spinal procedures or surgeries that we call for patients. That is usually outpatient surgery that take anywhere from 20 minutes to maybe 45 minutes. And we could actually go ahead and treat the source of the problem. We could possibly even reverse some of the damages that's been done to the spine and treat the problem so that patients will get long-term relief instead of a very short-term fix.
Yeah, when a patient comes to your clinic now and they either complain of back pain or leg pain, with the new technologies that you have at your disposal, how does that change the way you think about treating that patient?
It has changed what we call the treatment algorithm. Okay, we were taught, start with something simple, something easy, and then go more invasive or aggressive if simple things don't work. But with my experience, I know that certain problems, the simple things really don't work. Right? So why waste time? Why waste energy and effort with simple things when you know that you already know the answer, what's going to help the patients? So I usually bypass some of the things that I think is not very effective, providing this patient with long-term relief. So I talk about all the options, but at the end of the day, I'll also throw in, this is something that I think could make a big difference for you. Okay, it could provide years of relief rather than maybe a couple of weeks, a couple of months relief, and also keep you away from having major spine surgery. So, I think the way I think has definitely changed over the years, and are off what I think is the best for the patient, rather than going through the routine or what we call the treatment algorithm anymore.
Yeah, we talk about it even here. I'm sure even in your practice, maybe you do, maybe you don't, but we talk about it as like the family member test, right? Would you use this on someone in your family? And you actually have a story about that.
Bet.
I think.
Yeah, I told you that my dad, who had pretty severe spinal stenosis, ended up having one of these procedures done on his back, and he did well for 7-8 years, and unfortunately he has passed away since. But this is something, I believe it enough, that I will offer to my family members, and you don't have to look very far for the evidence. Okay, you look at your patients, you track your patients, you track their check the outcome, you know what works for the patients for what problem. Okay? So, I think that's the thing. You have to believe it enough, whatever the surgery or procedure is, you got to believe enough to offer to your family members. And if you treat your patients like you're treating your family members, I think, everybody's going to do okay.
That's why it's such a privilege for us that you're using some of the products that we offer, because one of our core values is patient first. And so we love playing a very small part in your hands so that you're able to treat patients in that way with that mindset. And we resonate so much with that. Like, if it's a family member, would you treat them with this?
Yeah, you would most definitely. You have to believe in the things that you do, right? Otherwise, I don't know. You can't offer patients that you don't believe in. Okay, so you always first thing you taught is do no harm, right? So obviously you don't want to do harm to your patients, but at least offer them what you think is the best option for them, for the problem they have.
Yeah, absolutely. Well, as you've been in it for 30 years, now we're to 2026, and with so many therapies being offered, different societies coming up. We've been talking about how this space has evolved so much, but where do we see it now in your mind in the next 5 or 10 years? Where's it going?
I think it's becoming, I think the boundary between spine surgery or neurosurgery and interventional pain management is become very blurry. Okay, so we are becoming more surgeons, and then surgeons are becoming more like pain doctors. Okay, because we're doing just about a lot of things that is very similar. And obviously, AI is gonna, artificial intelligence is gonna play a big part.
Yeah.
In the patient treatment. You could put in all these data and MRIs and X-ray findings, and AI might be able to help you come up with the best treatment option. You may be able to use artificial intelligence to build a spine model exactly like the patient's has, and then you may be able to even go ahead and do surgery on it before you actually go ahead and do the surgery on the patient.
That is really interesting.
Okay.
Have you seen some of these yet, or is this something that you're thinking about?
I'm just thinking about it, yeah. And then next thing is, I think there's a lot of future in the regenerative medicine.
Yeah.
Stem cells, gene splicing therapy, things like that. And then all the surgery is becoming more minimally invasive. Surgery to a small incision without going through major open surgery, so that risk is less, complications less, recovery is less. Patients don't have to stay in the hospital very long, or usually it's the same day surgery nowadays. So the patient could go back to whatever they enjoy doing faster and sooner and better.
Yeah, no, it's definitely changing. It's going to continue to change.
Yeah, it will continue to change, yes.
We'll sit down in 5 years and it'll look a lot different, I think.
Yeah. I'm looking forward to it. I've been doing this for a long time, and I've enjoyed the ride so far because I've seen it, how it's changed over the years, and I like it. I like it a lot.
Yeah, that's great. So one final thought for you. I know you're a teacher, you're an educator, you're a mentor. For those younger physicians that may be listening to this podcast, what's maybe a piece of advice that you would give them?
Talk to your patients and listen to them. Just don't treat the MRI or radiology findings, okay? Treat the patient, not the films, and also follow the evidence, okay? Pain medicine and everything else becoming evidence-based specialty. You have to. There are so many other things out there, and a lot of them is just a hype, big hype, okay? It's not going to last very long, okay? Look for the outcome. Look for the long-term outcome. Look at the data that's available. Look at the evidence that's available before you jump into something.
Yeah, well said. Thank you, Dr. Kim. It has been our privilege to have you on our podcast today. I learn something from you every time I speak with you, and so really appreciate the time. Thanks for being with us.
Thanks for having me. It's been my pleasure.
Awesome.
This podcast has been financially supported by Spinal Simplicity. The content is for informational purposes only and should not be relied upon as medical advice. The views, opinions, and information provided by participants are their own and may not reflect those of Spinal Simplicity. Healthcare professionals must exercise independent medical judgment, and patients should always consult with a qualified healthcare professional regarding medical decisions. Finally, the healthcare industry is constantly changing, and neither Spinal Simplicity nor the participants can guarantee the accuracy, completeness, or timeliness of the information provided in this podcast.